Well, the Delta variant is now the most dominant coronavirus mutation in the U.S., and the highly contagious variant is running rampant in communities with low vaccination rates. Here to talk to us about the spread of the infection across the country and here in the DFW area is Dr. James Pinckney, the founder of the CEO also of Diamond Physicians. Let's talk about the Delta variant. Many cities and areas of the country have been dubbed hotspots. North Texas is not one of those areas, but should people be concerned, especially because we do have hotspots areas, or hot pockets, I should say, pockets of areas in the DFW area with low vaccination rates?
Yeah, the Delta variant is very challenging. It spreads 225% faster than the original strain, and it's very concerning. So if you are not vaccinated, it actually has a 50% higher hospitalization rate as well. So the key to squashing the pandemic and ending the pandemic in America is absolutely being vaccinated. If you are vaccinated with either the Pfizer, Moderna, or Johnson & Johnson, you actually have full protection, almost 90% effective rate against the Delta variant.
And I know there's a lot of concern. How dangerous would you say this variant is?
It's very dangerous. Again, the mutation has allowed it to become what we call more sticky. So it's more infectious, about 50% more infectious than the original strain. It replicates faster in the lungs and the respiratory tract, and it actually you become more infectious sooner, about 4 days on average as opposed to 6 days. So it's spreading fast. 3 weeks ago, it consisted of about 10% of strains in the U.S., and today it's almost 56%. So it's spreading fast. We will have some outbreaks in certain pockets, as you mentioned, of lowly vaccinated individuals. So the key is to get vaccinated, and that will offer a lot of protection.
And Dr. Pinckney, there's now talk of a new variant out there, the Lambda variant. What do we know about this one so far?
Now, this one is very new. There's not a lot of information yet, but again, we're going to have lots of variants as we move through this coronavirus pandemic, and we expect even more variants. So again, right now, the studies have shown that the Johnson & Johnson, the Pfizer, and the Moderna are all extremely effective against the Delta. We're still waiting on data about the Lambda. But again, you can protect yourself by wearing a mask, social distancing if you are unvaccinated. And if you're vaccinated, right now, we're showing a lot of protection. So you can continue to, you can wear your mask or not wear your mask. The CDC recommends that you wear your mask in public transportation situations, whether it's a bus, train, or airplane. But other than that, if you're vaccinated, you can kind of resume normal life and get back to living before the pandemic.
And we know there's been a lot of hesitancies from the beginning about the vaccine. What do you say to people who are still unsure about getting vaccinated, especially considering that there's been so much research done on the vaccines?
Yeah, this vaccine class they're called messenger RNA vaccines. It's a whole new, brand new vaccine class. It doesn't enter the cells. It doesn't affect DNA. I've read a lot of reports about people being afraid that it changes your DNA and it can create infertility and all these other things, and no studies have found that. So the vaccine appears to be very safe. We've done a lot of studies, and right now it's approved for 12 years old and up, and hopefully soon our younger children will be approved for the vaccine, and the recommendation is absolutely get vaccinated as soon as possible.
Okay, and let's talk quickly about the release now, this new change about masks in school and the fact that students and staff are being told they don't need to wear masks. Should parents still be sending their kids to school with a mask?
Yeah, it's personal choice. If your child isn't vaccinated, it's okay if you want them to wear a mask. Right now, we're finding out that with the amount of vaccines that have happened in America, we think that it's safe for our kids to go to school without a mask. But again, it's a personal decision. Nothing wrong if you still want to wear a mask and you're vaccinated. There's nothing wrong with that.
Sure, and I know for a lot of this, it's been a personal choice. It's been about personal choice. As a parent, what would you advise parents to do?
We have a 4-year-old son, and he's going to school. And right now, with all the data out there, it should be safe for our kids. So I recommend going ahead and sending your kids to school, and really, it's really important for especially younger kids to have that socialization and get back to some sort of normalcy. It's great for the development. This has been a tough year for everyone, and we're almost there. So please go get vaccinated. That is the key, and it's going to absolutely save lives.
And we certainly want people to be safe. Dr. Pinckney, we thank you for your time.